The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rush office visits, both you and I can take our time and discuss your health care needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. I look at you when you're speaking, I listen to what you're saying, and I feel you both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. That's right. Call my office today. January 2023 is right around the corner. So call my office and let's set up a history and physical. To my military family, I got your 6. To my Masonic brothers, the light is bright. If you wait, it may be too late. Today's topic, medical errors part 2. That's right, part 2. The first part, the response and the feedback was phenomenal. And a lot of people said, I can't believe the number of medical errors, the types and causes. And I said, well, there were more because I basically ran out of time. So I figured, let's do part 2. All right, but before we continue with the show, remember the holidays right around the corner. I mean, it's 11 days away. So it's time for us to spend quality time with our friends and family. This gives us a sense of purpose, a sense of togetherness. We know statistically, those who are loners, spend time alone, have a shorter lifespan. So we need to share time with our friends and family so we can laugh. I covered this in a previous show, how important laughing is and how it makes us feel and how healthy it is. So spend that quality time with your friends and family, your loved ones, especially it's the holidays. That's what the holidays are. We celebrate togetherness, loving each other, loving our family. That's family first. Holiday time, family first. All right, so let's go on to, again, today's topic, medical errors part 2. So we said that medical errors happen when, despite there being a more correct treatment path for the patient, a different treatment is used inadvertently or contrary to what a reasonable practitioner would have chosen under similar circumstances. I went on to mention that there are several common reasons for these errors, and they were fatigue, user error, inexperience, and human error. And all professions have this. It's not limited to medicine. So the key is you won't want to go to work fatigued. You want to be careful what you do so we can minimize user errors. And if you're inexperienced, practice within your scope. Remember, I discussed the cardinal rules. Cardinal rule number 1, do no harm. Cardinal rule number 2, practice within your scope. Cardinal rule number 3, Learn and live by Cardinal Rules 1 and 2. Inexperience, you're not sure what you're doing, reach out to a senior. And human error, well, we make mistakes, but you want to minimize those mistakes. All right, so let's continue with most common preventable medical errors. I discussed these, and I'm not going to repeat except for one, which will be the last, but we're going to mention a few new ones. And while any medical mistake can be an issue, there are some that we see more often. These frequent errors can lead to a negative consequence for the patients and those who love those patients, okay? The family members. The mistake not only affects the patient, but the patient's family as well. So you have to be very careful what you do. Misdiagnosis. There are many reasons that misdiagnosis occur. All right, the wrong diagnosis can be catastrophic, right? Healthcare provider may not ask the right questions or may not order the proper tests. I discussed this last show, part 1, but I just wanted to continue. If your back is to the patient because you're pecking away on the computer, you're not hearing what the patient's saying, right? Because you're focusing on data input. Also, if you're not facing the patient, you're not seeing what they're saying because you need to see the body language. The person is speaking to you and they're telling you something, but their body language might be something different because they might be hiding something or they might want to tell you something, but they're afraid. So you need to look at them. Look, listen, and feel. Feel them emotionally, feel them physically. You do the physical exam. Now, if you misdiagnose, it could be serious, yes. However, if you're paying attention, right? Don't you remember our last show? I discussed a window, a period of time from the time of diagnosis to the time of treatment. We want that window period as short as possible. So if you do make a misdiagnosis, we're not perfect. We do make mistakes. Or we might be presented with a clinical presentation early on, and then a week later that clinical presentation changes. So we based our initial assessment on the first presentation, and then it changes, and that one happened to be incorrect. So by keeping that window, that period of time, that interval between treatment or diagnosis and treatment is short, or starting treatment and in a short follow-up, we can change our path, our direction, our treatment plan. That's the proper way to do it. So even though there's a misdiagnosis, we're making the adjustments as within a short period of time to make those corrections. If you let that window period of time go long, it's a very long period, then we have issues, okay? Now, I talked about that window period, the delayed time from onset and diagnosis, but let's talk about delayed diagnosis. A refusal to believe that there is an underlying medical condition can be just as dangerous as a misdiagnosis. All right. Now, I've never seen this. Okay. But, they say studies have shown that women and minorities experience difficulty in their pain and clinical symptoms being taken seriously by medical practitioners. This I have never seen, but this is what they claim statistically. I have never seen. I've been treating patients for 30 years. I have never seen this. Never seen this. Okay. I do see, or we see it in paper, something that's similar, but it's not a misdiagnosis. It would be someone where we are cherry picking who we're going to assess and treat. Give an example, Upper East Side, there was a psychiatrist, this about 6 months ago, gave a presentation, it may have been a year ago, presentation at Yale University, and saying that they wanted to see all white people bloodied and on the ground. That is a huge no-no. And for a psychiatrist to say that physician is unfit to practice medicine. That is a huge no-no. What do we say? Do no harm. Even the thought of that is unhealthy, and they need not to practice. A second, which was about 3 or 4 years ago, there was a resident physician down in Miami, and they said that they don't want to treat Jewish people. Another huge no-no. You do not practice like that. Individuals like this, I do not want you in my profession. You do not deserve that title. You do not deserve a license. You are dangerous and reckless. Other than that, I've never seen, turning away people. I shouldn't have to. If you're going to go into my profession to be a physician, you're there to care for all people. It doesn't matter what race, religion, creed, whatever it is, what language they speak, you're there to care for them. They are a human and they're there for care. That is why we take our oath to care for people. All right, so I got 45 seconds left already, part one. That's how quick part one goes. All right, come and join my practice. Let me help you lead a happier and healthier life. If you wait, it may be too late. To learn more about my practice, go to drtomio.com. That's drtomio.com. Or if you prefer to stop by my office, it's located at 250 Patriarch Yaphank Road, Suite 16, East Patriarch, New York. Or give me a call at 631-980-8200. That's 631-980-8200. And remember, I am taking no-fault patients, so if you're involved in a motor vehicle accident, you need a physician, call Dr. Tommy O today. Welcome back to the Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can take our time and discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. I look at you when you're speaking, I listen to what you're saying, and I feel you both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. January is only a couple weeks away. Let's set up a history and physical so I can get a baseline of your blood work and we can sit down and make an assessment and come up with a plan. All right, come and join my practice. Let me help you lead a happier and healthier life. So today's topic, medical errors part 2. All right, we left off with delayed diagnosis and then treating and mistreating with those 2 examples that I gave you. And that is so unprofessional. And that I'm talking about that's when we start writing the Office of Professional Misconduct. So here's an example. I'm going to educate you. If you have a physician or a provider, a hospital, a clinic, a diagnostic center, and you feel that they unprofessional, you can file a complaint in Albany. It's called the Office of Professional Misconduct, and you'll fill out forms, you submit it, and then that office is mandatory. They need to investigate. So if there's a complaint, you want to file a complaint, Office of Professional Misconduct. It's located in Albany, and you can call them. There's a form that you have to download, fill out, and mail back to them, and then they will investigate. You give their information, they will call you and interview you and take it from there. So there is a form of recourse. So now you have the information, you have knowledge now. Knowledge is power. Make that call, file a complaint. All right, so the next is I discussed infections, okay, and I was talking about post-surgical infections, but this is something I want to discuss. And for nosocomial infections, what does that mean? That means hospital-based infection. So we were, taught to clean. Wash your hands. This is in the early 90s, and so we don't have sinks in the hallways. So they installed the alcohol-based hand sanitizers, and so we started cleaning in between patients with your hands. So they did studies, and they found out that the source of infection that spread from patient to patient, okay? So these infections, they're spread from patient to patient. How? They found out that the stethoscope was the culprit. Not only the stethoscope, the doctor's ties. Okay, the ties. So we were carrying infection from one patient to one patient. So what we started doing was using an alcohol-based sanitizer, cleaning your hands, and using an alcohol pad and wiping your stethoscope down after every examination of each patient. And that reduced the risk of transferring infection from patient to patient. Also, you wear your white jacket, your white coat, okay? And it needs to be buttoned. Why? That prevents your tie from falling onto the patient, right? The patient's sick, there's food all over him, there's bodily fluids all over him, and that will contaminate your tie. Now, why do we need a white coat? Well, because the stitch, the stitch count is so high that the stitching is so tight that it becomes a barrier, and it prevents or slows down the absorption of bodily fluid. And that's why we have to have a stitch count. All right. So when you're buying your scrubs and you're buying your jacket, you want a high stitch count. All right. So, wash your hands between patients. Clean your stethoscope. When you come to my office, my tables are wiped down. I clean my instruments, and I keep my hands clean. Plus, I have I have in each office, I have a sink. Most outpatient clinics will have sinks because it's mandatory by the Department of Health. So let's reduce the risk. Clean between patients. I also have ultraviolet C-wave lights to help kill bacteria and viruses in my office, and they're on in the rooms. We also spray sanitizer, so the Lysol disinfectant to help keep the germs down. All right, the next is incorrect surgical procedure. I've never seen this personally, but I've heard stories about surgeons removing the wrong organ. Let's say you have let's say your right kidney is failed, and we have to remove the kidney. And next, they remove the left kidney, which is the healthy kidney, and they left the sick kidney, or the kidney that has diseased kidney in the body. Well, that's an issue. Does it happen? Yes. I don't think it happens that often, but there could be an error. So the surgeons that I work with, and I was very, very blessed that I have had really, really educated and strong mentors, my attendings, and the surgeons I work with. So in order to prevent error, before the patient went into the room, okay, the OR itself, because there's typically a hallway that you wait and then you enter, that they would ask the patient, okay, go back and forth, have an exchange. We're going to do, let's say, operation on the left knee. Left knee, yes, okay. They would either put a sock on the left foot, or they would put an X on the knee, so they knew that was the body part that we're going to go perform surgery on, and that will reduce the risk for errors. I've heard stories where they put x-rays on in the OR, and when they had the x-ray backwards, okay, and well, you're going to have the wrong side of the body that you're operating on. So we have to be smart there, okay? Take your time. You're not rushing. Let's reduce the risk for making errors. Can that happen in your office? Absolutely. You pay attention, ask questions, speak with the patient, confirm the procedure, confirm the side of the body. All right. This is something that we overlook, and that's failure to instruct patients for self-care, meaning after procedure care. You don't want to leave your patients vulnerable. So let's say I treat a patient, and then I say I did this procedure, or I put them on medication, and I will type in my note, post-procedure instructions given. For example, I gave a flu shot. So what I do is I'll tell the patient, all right, so I give you a flu shot. You may, apply ice to the area. I want you to look for any infection in the injection site. If you have aches and pains, they may use an over-the-counter medication like a Motrin, an NSAID, or a Tylenol if needed. So they have an idea of what to expect. And there's other procedures, and I do that. And I always put in post-procedure instructions given. And this will reduce the risk for complications or the patient having an issue and being rushed to the hospital, because they can give us a call and know what to expect, and they're not going to go into a panic. All right, I have about 140 left. The next is, I covered this and I rushed this in at the very end of part 1, and that's discharging from care too quickly. All right, so one of the goals of the in-hospital care is to minimize the risk for readmission. The last thing you want to do is discharge a patient and have them being readmitted within 24 hours. Well, that's a red flag, and what's going to happen is there's going to be an investigation. They're going to kind of come in and see what's happening, especially by the insurance company or possibly by the Department of Health. But there's a lot of pressure by the insurance companies and the hospitals to discharge the patient as soon as possible for financial reasons. Now, in the 90s, a financial incentive was given by insurance companies for the providers to discharge patients under 24 hours, okay? Well, sometimes we need more than that, okay? Sometimes you need a few days. So let's not rush, all right? Let's not be under pressure by profit, okay? And that's what's happening. Stop the nonsense. Care for the patients. Stay out of the way. Let the physicians care for the patient. All right? It's not about the profit. Yes, it's about caring for patients. That's why we're in this business. All right, so we got 23 seconds left. Part 2, that's how quick it goes. Come join in my practice. Let me help you lead a happier and healthier life. If you wait, it may be too late. To learn more about my practice, go to drtommyo.com. That's drtommyo.com, or give me a call at 631-980-8200. 631-980-8200.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.